Oh, happy weekend, everyone. I'm Dr. MG Aditola. I'm a physician who's based in Canada. I've been here for 24 years. In fact, it was exactly this month that it's been 24 years since I've been here. So I was scrolling through Facebook and I came across a Facebook reel earlier this week. So I made a comment underneath that I would like to be able to come and address some of the issues that were raised. It was just a 1 minute reel, and I'll play it in a moment. It's a Daddy Freeze reel, and it's possible he may not have seen my comment. And I remember sometimes last year too, I saw something about some people saying, oh, it's easy for them to get MRI in Nigeria, so they live in Canada and they run across back to Nigeria to get MRI. But anyway, some of these issues I come across every now and then. Unfortunately, I don't follow Daddy Freeze a lot. There's nothing wrong with Daddy Freeze. It's just that I'm very busy and time doesn't permit me. So a lot of Nigerians are coming to Canada now, and they have to, fortunately or unfortunately, interface with the Canadian healthcare system. And I think by making this, some of them may just understand the Canadian healthcare system better. So that's why I'm doing it. So listen first of all to the reel I'm talking about, and then we'll talk about it in a moment. The reason is Canada has excellent healthcare delivery system, and I hope someone is helped by this video I'm making. Thanks for this opportunity to come on this live. I live in Canada. I live in Ontario. I've lived in 3 countries, and I'll do some comparison here. I've lived in Switzerland way back 2009. That was when I was out. Because for me, I just wanted to live outside. Then from there, I migrated to United Kingdom. And I stayed for like 15 years before I came back to Nigeria. Then from there, I came to Canada. So let me do the differences. Nigeria is good. Once you have a very good thing giving you what you want, there's no point, to be honest, coming to this country. When I was living in the United Kingdom, I used to work for the NHS. I did fantastically well. UK has a lot of jobs. There's a lot of stuff going on there. Do you get me? And when I came down here, I saw the differences. In terms of healthcare, UK is still number 1. Canada is far behind. So now, the point of contention here is this gentleman who was speaking was knocking the Canadian healthcare system, and his word is Canada is far behind, and he was making a comparison between Nigeria, the United Kingdom, and Canada. Now, the first thing I'm going to say right out of the bat is per capita. Back in 2021, Nigeria spent $84 per person. That is, if you divide the amount of money that Nigeria spends on healthcare per person in Nigeria, it came to $84 per year in the year 2021. In that same year, Canada spent $6,514. But so I'm going to divide my talk into 2. First of all, just looking at pure stats, and then how someone who has just arrived in Canada can access healthcare in Canada. Because I know it's a new country, sometimes just getting through, settling down, trying to get through the healthcare system while you're trying to get your job and get your life in order. Some of those things can be very, very difficult for somebody who's just arrived in a new place. So hopefully I'll get through this in about 10 minutes. My bona fides, first of all, like I said earlier on, I graduated, by the way, in Nigeria. I trained in Nigeria. I went to Ogun State University, now it's called Labisi Onabanjo University. I left Nigeria about 30 years ago. I did my postgraduate training in South Africa, and I've practiced in South Africa for about 5 years. I practiced in Nigeria itself for 5 years, and then I've been here for almost 25 years now. So I've been a doctor for 35 years. And I've practiced in Newfoundland, I've practiced in Ontario for 14 years, and now I'm in Saskatchewan. I've been here for about 6 years. Now, I've also been privileged to be president in waiting, and also full president of the Canadian Association of Nigerian Physicians of Canada. It's called CAMPAD. And I have academic credentials to train both undergraduate and postgraduate doctors in the University of Ottawa and the University of Saskatchewan. I also do train as alumni faculty for Ogun State University. In fact, we got for our postgraduate re-accreditation for the West African College and the Postgraduate National College just this week that ended, this week or last week, thereabout, for another 5 years. That's for the University in Nigeria, so up school. Now, to the issues at hand. The life expectancy in Nigeria is 53 and a half years. 53 and a half years. The life expectancy for people in Canada is 81 and a half years. And the life expectancy for people in England, that gentleman was comparing Canada to, is 82 years. So life expectancy in Canada, 81 and a half. Life expectancy for people in England, 82. Infant mortality rate in Nigeria, that is per 1,000 live births. How many children, 1,000 that are born that will live till 1 year in Nigeria, sorry, how many children that are born alive out of 1,000 that will live, that will die before the age of 1 year? 547 out of 1,000 will die in Nigeria. Only 3.94 in Canada will die before the age of 1 year. 3.94 out of 1,000 will die in Canada. In the UK, 3.9. So can you see the Canadian and the British figures are very similar. 3.94 in Canada, 3.9 in England. Whereas in Nigeria, 547 children out of 1,000 will succumb before the age of 1. Let's look at maternal mortality rates. Out of 100,000 babies that are born, 1,047 moms will die. In Canada, 11. In England, 13.4. So the Canadian figure is actually a bit better than the UK. But again, statistically, probably not too different. Now, the UK, there are about 70 million people who live in the United Kingdom. But the United Kingdom, they have 296,000 registered doctors. 296,000 registered doctors. Canada has a population of about 40 million. We only reached 40 million last year. But we have 96,000 doctors practicing here. About half of those are specialists, 96,000. Nigeria has a population of about 240 million, but only about 35,000 doctors who are practicing in Nigeria. Now look at that. England, the UK, has 70 million people, but 296,000 doctors registered. Canada has 40 million, but they have 96,000 doctors. Whereas Nigeria has 240 million, but only about 35,000 doctors. If you look at the physician-patient ratio for Canada, it's about 247 per 100,000, whereas that of England is about 230 per 100,000. Let's not even talk about that of Nigeria. As a percentage of total health spending in 2022, the UK spends 11.35% of their GDP on health. 11.3. Canada spends 11.1% of their GDP. Nigeria spends 4.08% of their GDP in 2021. 4.08. And that gentleman was saying things are better in Nigeria. I don't know what he's talking about. All right. So if we're looking at statistics, here's what I'm saying. The statistics for the UK and Canada are practically the same. Practically the same. There is no difference, both in terms of spending and in terms of outcomes. They are the same. So the UK is not better than Canada. Canada is not better than the UK. Spending, outcomes, resources, and all of those things. It's the US, on the other hand, that is actually outspending every single one of the OECD nations. However, if you now look at the outcomes, what this US is spending does not actually match the results because they're outspending everybody in the OECD, but their results are actually mediocre. But My bigger issue today is to Nigerians who are arriving here in Canada but are having a difficulty in getting the healthcare that they have. Now, even though we have 96,000 doctors that are registered here in Canada for 40 million people, we still know that we have a healthcare personnel shortage. There's still a shortage. Unlike England, where they have had, for instance, they've been able to integrate nursing specialists and those kind of things and people into their healthcare system. We're beginning to do that here in Canada too, but we're not at the level where the UK is because they've been doing it for longer. Unfortunately, what many people do is when they're sick, they just go to the hospital. No, they've not been able to understand that the basis of healthcare delivery is actually the GPs, what we call the family physicians here in Canada. So the first thing I'm going to advise our people when they arrive in Canada is to try and find family physicians or GPs. Okay, in the area where you live, there should be go online and find family physicians who are still accepting patients. You may get lucky and find one. The government is trying to put resources in place to online, and there will be physicians who are advertising and websites that are advertising for your local healthcare network, saying this physician is accepting and that physician is accepting, that physician is full. Find those kind of doctors. If you cannot get one, there may be a nurse practitioner in your neighborhood is accepting. Fine. In the meantime, oh, by the way, one thing to say, 95% of your healthcare needs can and should be addressed by your family doctor. 95%. It's only in about 4-5% that you really need to be in a hospital. You don't need to go to a hospital because you have a cold. You don't need to go to your hospital because you have a sprain or you have, what do I say? Even things like pneumonia and stuff, your family doctor can deal with most of those things. And in any case, when you go to your family doctor, if he thinks that there's something that he cannot deal with, he will send you to the hospital. Okay. Now, the other thing is, if you don't have a family doctor yet, you can go to a walk-in clinic. You can go to an urgent care. People think that when they go to the hospital, they're going to be attended to on the basis of a first come and first served. That's not the way it works. The way it works is those who are life and limb threatened are going to be attended to first. You see, the nurses, when you get to the hospital, the nurses will assess you. They have their own way of, we call it a triage. Triage simply means we're going to look and say, hey, whose life is threatened here, whose limb is threatened. The nurses are trained to assess who, not just, if you may scream and shout and say, I'm in pain and all of that stuff. That we don't assess people based on that. We assess based on whose life or limb is most threatened, and those are the people who will get ahead. And that is why people will say, oh, I went to the emergency room, I was there for 8 hours, I was there for 10 hours, and they didn't see me. It's because there are people who are more sick than you. They're going to get in ahead of you. That's the way it works. And then there's also something that people should learn to do. Instead of going to that city hospital, which is very, very busy, there are some small towns around you that will have emergency room too, even if you have to go to the emergency room. Some small towns around you, the small hospitals are also fully equipped. They have laboratories, they have X-ray, they have CT scan, they have ultrasound. So for instance, when I was in Ottawa, even though I had privileges as a doctor at the Civic Hospital, which is one of the biggest hospitals in Ottawa, in fact, it was the biggest hospital. I was a doctor there. But when I was sick, I wouldn't even go to the Civic Hospital. I would drive 40 kilometers out of town to a hospital called Winchester Hospital. It's a smaller hospital, but Winchester Hospital had surgeons, had internists, had obstetricians, had CT scan, had laboratory. That's where I will go for my own healthcare. It will take me about 25 minutes to get there, and I will go there, and I will be attended to. So sometimes all you need to do is drive down. The roads are good here. The cars are good. Everybody is good. And just drive down there instead of going to sit 12 hours. And when I will go to Winchester Hospital, there will be 3 people in front of me. And within 1 hour, I'm attended to and I'm back home. Okay, so find a family doctor. And if you don't have a family doctor yet, go to a walk-in or go to the urgent care. In the city where I live now, I live in Regina. We have two big hospitals here, but we also have an urgent care center. The urgent care center has practically everything. But the only thing is we don't have an operating room. We don't admit anyone overnight. In fact, by 12 p.m., it's going to shut down. All right? And then the ER should be the last resort. ER just means emergency room. If you don't have an emergency, don't go to the emergency room, otherwise you will be there for a long time. But if you have an emergency, you will be. Emergency means like a heart attack, you broke your leg, you can't breathe, call the ambulance or whatever and go in there. So, because that gentleman who was speaking in that video I played is from around Toronto area, you can go to Orangeville Hospital, you can go to Toronto East or whatever. And for those who are living, say, around Ottawa, for instance, they can go to Winchester, they can go to Kemptville Hospital. That's the way to negotiate healthcare here. So let's put enough to all these, the healthcare system in Canada is bad. It's not. The healthcare system here is excellent. So just 2 days ago in my office, I was showing this video to one of my Nigerian patients. Now, it just turned out, this is a real life experience. So 2 weeks ago, she was sick and very sick. She went to the hospital here. It turned out she had an appendicitis. And she did wait because at the time she didn't even know what was wrong with her. And eventually she was seen and she had surgery done, laparoscopic, this keyhole surgery. And they also found that she had gallbladder stone, which she didn't even know she had. And so they did the two together. They removed her appendix and they also removed those gallbladder stones for her. She's very glad. She's almost healed. These are from keyhole. She had one in the belly button and she had one in the upper abdomen and another one there. You will not even know that she had surgery. And she's so glad. And where she was joking that, she's happy this wasn't done back at home. It would be like, somebody butchered her belly because she's had a cesarean section done at home before. Now, people are coming on this kind of shows I was talking about because they have a lot of money in their pocket and they have access to the best private hospitals in Nigeria. And so they come and share all of these experiences of how they can go and have MRI done the next day and CT scan done. Whereas 99% of Nigerians don't even have this kind of access they're talking about. And then when you have the MRI done, what are you going to do with it? If you have a tumor in your head, where are the places where you're going to get the top neurosurgical care? In Lagos, in Abuja, and where else? How many places? And God forbid you have cancer. Where is the nuclear scan in Nigeria that you're going to get done to really have a proper cancer care that you really need? Let me tell you one thing. Here in Canada, if you're a permanent resident or a citizen, if you're sick and the doctors say you need MRI, you need CT scan, you need surgery, you need oncology care. Oncology care means cancer care. You don't pay a dime. You don't pay a kobo of your money. Not one kobo. It's not like a US that they're going to say, you have insurance, you don't have insurance. You don't need any insurance for your healthcare needs to be taken care of Canada. For your healthcare needs, Canada is the best place to be. I hope you heard me now. And please, for God's sake, if the doctor tells you you have fibroid, or you have some surgery, you need to have some surgery, and they've put you have severe arthritis in your hip or knee, and you need to have surgery done, and they're going to put you on the waiting list. Please stay on that waiting list. It doesn't matter whether it's going to wait 3 months or 6 months. You're not going to die. When it is done, you will be fine. Please don't rush anywhere to go and have that surgery done. Your life is not being threatened. Your limb is not being threatened. You will survive it. You'll take pain medication, and then when the surgery is done, you will be fine. Believe me, I'm telling you. It's been a pleasure sharing this experience with you. I thank you for listening. Once again, my name is Mutunrayo Adetola, past president of Canadian Association of Nigerian Physicians and Dentists. Bye-bye.